Ben Johnson is a 22-year-old male that is presenting with diabetic ketoacidosis. He was brought into the ER by his roommate because he had difficulty waking him up. His height is 6 feet or 72 inches, and current weight is 202 pounds and has a BMI of 27.4. Upon admission, his blood glucose was 497. His urinalysis showed high levels of glucose, protein, and low pH. He has been complaining of nausea and vomiting over the past few days, along with extreme thirst and frequent urination. All of these symptoms are a result of the high glucose levels that he's been experiencing. He has been drinking large amounts of orange soda in an attempt to quench his thirst. It is also noted that he had a couple of beers the day prior to admission. The patient also reported that he drinks 6 to 7 days a week and between 3 to 12 beers on each of those occasions. While type 1 diabetes isn't a result of diet, upon further review of his 24-hour recall, his diet does seem to be very heavy in simple carbohydrates and fast food, which is a contributing factor to his glucose levels. There may or may not be a genetic component to his development of type 1 diabetes. He isn't aware of any family history. A clear liquid diet was ordered to prevent any further increase in his blood sugar levels, which will remain in place until his levels become more stable. He initially received a 10-unit bolus in order to gradually bring those levels down. After the bolus, he is to receive 5 units per hour of insulin. He also received an order for a 50% dextrose solution to take PRN for hypoglycemia. Based on his weight and using 25 to 30 kcals per kilogram, that would give him a range of 2,300 to 2,760 calories per day. Weight bias is shown specifically by Kathy, one of the nurses. She recommends that he see a dietitian due to his BMI and 24-hour diet recall. In this instance, I would talk to her and let her know that I understand her concerns. I would also explain that while his BMI is higher than normal, there is some discrepancy in the chart pertaining to his height and weight, but we really need to focus on managing his diabetes. Once his diabetes is under control and he's had the proper diabetes education, some of the concerns that she has may actually resolve itself. For example, he won't feel as thirsty and hopefully won't be drinking as much orange soda, which will significantly decrease his overall calorie intake. Through motivational interviewing, I would determine his willingness to change his eating habits, especially his alcohol intake. The ER notes state that he doesn't feel that the amount he drinks is an issue. I would use this as a way to understand why he drinks as much as he does. And he doesn't seem to have a very strong relationship with his family, and this could be a contributing factor. He may be experiencing some form of depression that needs to be addressed. A study conducted by Oliver tested how integrating weight sensitivity training into the curriculum of undergraduate nursing students would affect weight bias. Upon completing the training, students had a more positive attitude toward overweight individuals and also an increase in the belief that obesity is not always controllable.